Hello, everyone. Welcome back to the Dialexicon podcast, a podcast where we critically engage in philosophy and correlate philosophy research to contemporary issues that affect us all at an easy and hopefully digestible level. My name is Saurish and I'm your host. This week, we're joined by Professor Chad Horne, who is an assistant professor of instruction at the Department of Philosophy at Northwestern University. Hi, Dr. Horne. How are you today?
I'm doing good, Saurish. How are you?
I'm doing well. Thank you for your time and for being here today. Before we begin our discussion, I asked all my guests this one question, and I want to ask you as well. How did you get into philosophy? What stood out to you?
Yeah, well, let me say first, thanks for having me too. I'm very happy to be on the podcast. I guess when I was in high school, or really as far back as I can remember, I've always been really interested in politics. And like a lot of people, when you're interested in politics, you don't just want your team to win. You don't want just to like enact your preferences, but rather you have a theory of like why a certain set of political outcomes would be on the for the best overall. You have a kind of theory of what the state is supposed to be doing and why. Back in those days, I was really interested in the work of John Locke, and I was kind of a young libertarian, thinking people have rights, and the role of the state is to protect those rights, and that places limits on what the government can do, and so on. So I got to college, and I discovered that you could take classes in this, you could study this, and so I started taking classes in philosophy and political theory. I took two my first semester, and no one ever told me to stop. So I just kept going from there. Yeah, that's sort of how things got started. Thinking about what are the values at stake in public policy? How do those values relate to each other? How do we kind of put those values together into a coherent theory of political justice and all that good stuff?
So were your, I guess, like interests focused towards like, I don't know, maybe like the actual heavy side of like being a politician, like poli-sci relationships, or like, I guess like even IR maybe, with the way in which like states talk or discuss with each other. Was that your interest, or was it always like the sort of background questions about what are we supposed to prioritize? What are our values here? Or what was that? Like, what was that distinction maybe?
I think I've been interested in public policy and the kind of philosophical underpinnings of that. So, what should we be trying to do? What should we be trying to accomplish? And what are the set of policies that are going to get us closer to that goal? So yeah, international relations was never something that I cared too much about, but always thinking about the role of the state, the limits of the market, healthcare, as we'll talk about today, and public health and things like that, and again, what the sort of underlying values that we ought to be trying to express in that domain, what those amount to.
Okay, that's awesome. Definitely shows like, I guess like a profound interest in philosophy from a very, very beginning almost. I think like some of the other guests have like an interest in something else and they turn into philosophy, but definitely cool that you have that interest from the start. And so before we talk about like the specific research, as you mentioned, on healthcare, I wanted to ask just about like medical ethics and in general, what are some of the questions that medical ethicists are concerned with solving, and are there different branches of medical ethics?
Yeah, I think that the way to think about medical ethics is that it's a branch of, or a species of, professional ethics. And what's distinctive about the professions, medicine, of course, but also law and engineering and management and so on, is that on the one hand, the professional has a certain specialized body of knowledge, right? They know a lot that the layperson doesn't know, that their patients or their clients don't know. So there's that. And then at the same time, of course, the reason why you typically go to see a professional, whether it's a doctor or a lawyer or whatever, is often because you're in a state of great vulnerability. You're sick, or you're in some kind of legal trouble, or and you need help. And yet again, because of the specialized knowledge that the professional has, it's very difficult for a layperson to know whether the professional is doing their job properly, whether they have your best interests at heart, and things like that. And so the role of professional ethics, I think, is in a way to kind of signal to the public that professionals are credible, are trustworthy, that they have a set of moral commitments that guide them in making sure that they're delivering medical care or providing legal counsel in a way that's centered on the well-being and centered on the interests of the patient. And so I think of medical ethics like legal ethics, like engineering ethics, as a way of, again, of sort of signaling that credibility to the public. We know, during the COVID-19 pandemic, I think we've seen that a lot of people actually don't have a lot of trust in the medical community. And the costs of that lack of trust can be really, really high, not only for individuals who maybe don't get the medical care that they need, but also for society as a whole, when people are not willing to get vaccinated or not willing to follow other kinds of medical advice around distancing and masking and so on, right? So I think of medical ethics as, again, trying to sort of fill that trust gap, trying to demonstrate that credibility and allow people to, to go to the doctor and feel that the doctor is going to have their best interests at heart. So what are sort of the classic questions of medical ethics? They have to do, I guess, with those sort of hard cases where maybe it's genuinely unclear what it is that you want your professional to do. In my classes, we spend a lot of time talking about what physicians should do in cases where what the physician thinks is good for the patient and what the patient wants come apart. Right, so the patient wants one thing, the physician thinks that it would be in their best medical interest to do another thing, right? That presents a really difficult case, a kind of conflict between respecting the autonomy of the patient versus doing your best to promote the patient's health and the patient's well-being. Those kinds of cases, come up a lot in medical ethics. And so we talk about, informed consent and the meaning of that and the value of that. And are there cases where, it's appropriate to treat a patient in the absence of informed consent? But there's a whole range of other questions. Confidentiality is something that comes up in all the different species of professional ethics, keeping the client or the patient's information secret. In my class, we talk about the ethics of human research and how to balance the physician's obligation, ethical obligation to look out for the best interest of their patient to the obligations that they may have as a scientist to the integrity of the study and to the rest of humanity as potential beneficiaries of that research, right? So just kind of all those different areas where it's maybe just genuinely unclear what it is that you expect of your physician or what would be the right thing for the physician to do in those cases.
So when we're when we're exploring these things, is it A, solely just about trust? And then B, if it is, or I know there's probably a high relationship to trust and credibility here, but how do we actually tell the public about this? Is there an aspect of advertising within your courses or within philosophy in medical ethics as a whole? Because I feel like oftentimes philosophy is overlooked a lot in terms of in the actual philosophical research. I feel like everyone innately kind of has these values for sure, but we kind of overlook that these decisions might be made by certain councils, certain ethical committees. So is there a large part of medical ethics and maybe professional ethics as a whole about bringing this ethical research to people who might not know it, or is it just kind of exploring those those standard cases and defining rules or guidelines for those?
Well, one of the things that makes medical ethics different from other aspects of academic philosophy is that in medical ethics, there's also a significant, real world component. There are professional philosophers in universities who write and teach and think about medical ethics, but there are also practicing physicians who are ethicists, and there are professional organizations for physicians and nurses and pharmacists that get together and discuss these questions and come up with an official code of ethics, right? So if you ask the American Medical Association what their position on informed consent or what their position on paternalism is, or any ethical question, you can go on their website. Actually, they have a code of ethics that they publish, and so if you're studying these questions in an academic context, of course, we want to investigate whether we think that the conclusions that the AMA has come to stand up to the best philosophical scrutiny that we can muster and so on. But if your question is, a question about, how is this communicated to the public? It's often communicated to the public through their physician and through the professional organization that their physician is a part of. Professional organizations often have a role to play in enforcing those codes of ethics, right? So in cases where there's a very severe breach of ethics, a physician, for example, can face not only legal consequences but also consequences from their professional organization. So I think that's kind of the way in which that those kind of ethical standards get both communicated to the public and also have a certain degree of enforcement built into them.
Definitely, that makes sense. And I guess it also kind of shows the way in which like these questions and like I guess the people who are exploring them actually have legal and policy decisions or effects on policy decisions, which was kind of like a question that's kind of vague sometimes. Like in philosophy, a lot of different fields, there's like a lack of translation into actual policy decisions. Like I remember in like legal epistemology, a lot of those questions aren't actually translated into the legal system, and so like it unfortunately seems like a common trope within a lot of philosophical branches and fields, but it's good to see that in medical ethics, like there's actually like a lot of respect for those decisions and kind of those explorations. So I want to talk more specifically about your research. You wrote a paper with Professor Joseph Heath titled "A Market Failures Approach to Justice in Health." So what is the complete theory of justice in health that is derived from correcting market failure? What do you mean by market, and like what is justice when it comes to health?
Okay, good. So that's a big question, and let me do my best to try to answer it. So the first thing I want to say is that we've been talking so far about medical ethics and medical ethics in the kind of narrow sense of, when you're in the room with the physician and the physician needs to make decisions about your care, what kinds of ethical principles and ethical constraints ought they to have in view, ought they to be respecting, when they're engaged in that physician-patient relationship. My work is really about kind of the political philosophy of health and healthcare. And so thinking about, how should the healthcare system as a whole be designed? What are the moral problems that need to be solved in the healthcare system? Is there, for example, a certain level of healthcare that ought to be guaranteed to everybody? Is there anything wrong with a system where a system like the system we have in the US actually, where some people don't have access to healthcare insurance and can't get the healthcare that they need, or anyway, in certain cases are unable to get the care that they need? What would be wrong with that? What kinds of procedures ought to be available to everybody? And what's the best, moral account of the why of all of that? So that's the question that we're asking. And if you look at the philosophical discussion around this, I would say the overwhelming consensus among philosophers is that the value that you need to appeal to, or the value that you need to have in mind when thinking about the healthcare system, is the value of equality. So, the value that helps us to make sense of the healthcare system, or that justifies a just system, is about equality, where the idea is that the basic problem with our healthcare system is a problem about affordability. That is to say that there's a group of people who are unable to access care because they don't have sufficient income to buy decent health insurance, and there's a threat or a concern that they'll be unable to access necessary care. I think this is actually part of a sort of broader common sense in political philosophy, that, if you look at the way our society here in the US functions, right, we have kind of two big institutions. We have the market and we have the state. And the market, I mean, people will say different things, but the market we like, because the market is really good at producing lots and lots of wealth. It's really, really good at increasing people's well-being and creating new technologies and disseminating those technologies and just making us all rich and prosperous. But the problem with the market is that the market outcomes often are very, very unequal. And some people make obscene amounts of money and other people do not have enough to get by. And so that's where the other institution comes in, the state, right? So the state is all about equality. And so it takes the wealth that the market produces and it makes sure that the wealth that the market produces is distributed in a way that satisfies our moral intuitions about equality. And I think that's kind of I would suspect that's maybe the person on the street's view if you ask them, but it's certainly the common sense among philosophers, right? That the market is about economic efficiency and economic growth, and the state is about redistributing the fruits of that growth to make sure that everybody benefits. So I think that there are basically two big problems with that picture. The first problem is just that if you look at what the state actually does, the state actually does a lot of stuff that looks like producing goods that the market is failing to provide us, right? So, our national politics doesn't tend to focus on these things, but like, what does the state do? Well, the state provides roads, it provides sewer systems, it provides police protection and fire departments, national defense in the form of a military and security against invasion. It provides education. It provides, a whole host of other things. And it's possible to tell a story based in equality about why the state provides roads or why the state provides fire protection and sewers. But I think the more natural story is actually just that, these are goods that people want to enjoy, and that the market is not so good at providing, right? The market fails to provide in an efficient way. So one problem with that simple story, again, is that it looks like the state actually does a lot of stuff besides promoting equality, right? In the form of actually providing goods and services that the market's not doing a good job of supplying. And then the other problem with that story, right, the simple equation of the state with equality and the market with efficiency, the other problem with that story is that, if equality is all we're really concerned about, that is to say, if the worry is just that some people don't have enough, then there's actually very little reason for the state to actually be involved in producing and delivering goods to people. There's, I think, a pretty powerful argument that the market is normally better at doing that kind of stuff. And if we're really concerned about equality, what we ought to be doing is just giving people money, right? Redistributing wealth, and let people go to the marketplace and buy the goods that they need, right? So, so I think there's, again, a kind of a couple problems with that very simple story. And the story that I propose instead, and this is a story that Professor Heath has developed, and I did my PhD with him at the University of Toronto. He was my supervisor, so I don't want to claim credit for this story. But the story that he wants to tell, and the story that I'm kind of piggybacking on, is that we really ought to look at the market and the state not as pursuing alternative goals, efficiency in the market, equality in the state, but rather we ought to think of them as pursuing the same goal, right? That there are, or at least when it comes to the provision of specific goods like national defense and sewers and healthcare and things like that, right? That there are certain kinds of goods that that the market is not very good at supplying. That where the market fails to supply those goods, either fails to supply them at all, or fails to supply enough of them, right, at quantities that people would truly benefit from. And when those kinds of situations obtain, when you have that kind of market failure, then there's a powerful case for the state to actually just step in and deliver those goods in one way or another. So the story is very easy in the case of roads, for example, right? The market functions best when you have a competitive market, when you have multiple providers who are competing to provide the best deal and the best value to consumers. But how would that work in the case of roads, right? How would you have different road providers competing with one another? Are we going to build multiple roads to every house in the community and let the different providers compete on tolls and on maintenance and quality and stuff like that? That seems really wasteful. And arguably the better solution is for the state to just build the roads and let people use them, and so on. How does this story apply in the case of healthcare? Well, in the case of healthcare, things are a little bit more complicated, but the key to it, as I see it, is that we really ought to think about state involvement in the healthcare business as not really being about health care, but as being about healthcare insurance. And so there are pretty well-known problems with the market provision of insurance. The market fails to supply certain kinds of insurance efficiently. And the primary reason, as I argue in the paper, is what's known as adverse selection. So this gets a little bit technical, but the basic idea is that if you are selling health insurance on a voluntary basis, you are really likely to attract a preponderance of sick people to your insurance plan. People who already have serious health problems, or people who expect themselves to have serious health problems, are much more likely to buy insurance compared to somebody who is healthy and expects to remain healthy. And so this, so this means that with market-based insurance, you tend to attract a disproportionate population of people with expensive healthcare needs. And that really wreaks havoc with the market for insurance. The story about how exactly that goes is a little bit complicated, but I don't think we necessarily need to go into that here. The way that most developed countries, most countries with universal healthcare systems address this problem is by making the purchase of health insurance mandatory. And what that does is it makes sure that you don't have an insurance pool that consists exclusively or anyway overwhelmingly of people with very expensive health needs, right? You have a sort of balance of high cost and low cost people in the pool, and that allows the insurance system to function more effectively, function as it's intended to. And so, as we say in the paper, you can think about, there are a lot of different ways of solving this problem of making insurance mandatory. Lots of European countries actually achieved universal coverage through a system of mandatory private insurance, similar to the way that the individual market in the Affordable Care Act, aka Obamacare, was supposed to work. So in the Netherlands and Switzerland, you don't actually have state-provided insurance. What you have is the mandatory purchase of private insurance. Of course, other countries do have just a single public insurer that provides insurance directly to everybody. That's what they do in Canada. Other countries have socialized medicine, and so they kind of eliminate the insurance system altogether, and they just hire a bunch of doctors, and the doctors provide medical care directly to the population. Our view is that these are all different ways of solving the same fundamental underlying market failure, right? And allowing a good, namely health insurance that people want to have, that's really beneficial to people, allows that good to be provided in a way that it wouldn't be provided by the free market. Again, the idea there is that the state is stepping in, not just because there's a kind of inequality problem. If that were the problem, you could just give people money and let them go buy insurance. But the reason why that's not an adequate solution is precisely because of the difficulties in private insurance markets, the ways in which those kind of systematically fail. And so there's a powerful case for the state to step in one way or another and mandate the coverage of insurance to address that problem. So that's the basic story. Maybe I'll just pause there and see where you want to go next.
Yeah, definitely. I kind of am interested in the ways about talking about healthcare as a whole. And we did talk about affordability as a whole, and we talked about kind of other countries and their system. So kind of some of the questions that ring to me, when I'm thinking about healthcare, is affordability, right? That's the biggest problem maybe in America, that a lot of Americans aren't able to access healthcare properly because of the high costs. And so I don't know too much in this domain, but I think I'm aware that the countries like UK, most of it is affordable because of taxpayers kind of fund healthcare in general. So to me, it seems that seems like the most equitable approach to getting people who need actual medical help, getting them medical help. So how does this kind of approach take that into consideration. I feel like there, is that like a viable alternative that we can implement inside of a marketplace system like the United States? Because I know like this has been like up for debate for a very, very long period of time. Like even like, like senators and even like, the president will have it on their campaign that they're going to do something about healthcare. And unfortunately, I don't think anything ends up happening. So like, what does your paper, I guess like your thoughts on and the justice in the healthcare department, place like free healthcare as?
Yeah, so let me say two things about that. The first thing is that we don't want to say that equality has no role to play in the healthcare system. And I can't speak for Professor Heath, but I'm very happy with the idea that to the extent that there are people who are unable to afford decent healthcare coverage, there's a social obligation to help those people and to make that coverage more affordable to them. But the key point that I want to make in the paper is that if that was the only problem, if affordability was the only issue, then there would really not be a strong case for a national healthcare system. There would not be a strong case for something like Medicare that's providing health insurance directly to individuals, right? We can just give people a check and they can go buy private insurance on the market. And that's the way that most societies, including our society, deals with inequality when it comes to other basic needs. There's not a national debate around establishing a system of universal basic food that would we just grow food and deliver it directly to people who can't get enough food to eat. Nobody proposes a system like that. We just give people money or we give them vouchers and they go to the grocery store because the grocery store is very efficient at delivering food to people. And if the only problem is a problem about inequality, you can just solve that problem with checks. But what we think is really significant about healthcare is that the affordability issue is not the only problem to be solved, that there are real problems with the private provision of insurance and the well-functioning of insurance markets that goes beyond just insurance being very expensive and some people not being able to afford it. Right, so that's the first point I would want to make. I don't have a problem with the idea that we ought to be helping people afford insurance that they're otherwise unable to afford. But what we want to say in the paper is that if you want to tell a story about why a national healthcare system is a good idea, why Medicare for all might be a good idea, you need to appeal to the ways in which the market for health insurance is really dysfunctional in a private system. So that was the first point. The other thing I wanted to say is that I think our approach is also quite congenial to thinking about the affordability issue, not just as an issue of some people not having enough money, but also an issue of healthcare costing too much. And in particular, right, there's a kind of a kind of collective action problem that emerges with insured products like healthcare. It's similar to the way, I don't know if you ever, you go to a restaurant with friends and you know that at the end of the meal, they're going to bring just one check, right? Like the check is going to just come, it's going to have everybody's food on it. And so, I've been in this situation where it's like, well, if we're all going to just split the check evenly, then maybe I'll have an appetizer when I wouldn't have an appetizer. Maybe I'll have an extra drink or a dessert that I wouldn't otherwise have, because I know that at the end of the day, the bill's going to be split among everybody. The problem, of course, is that with everybody reasons that way, then at the end of the meal, the bill comes and it's astronomical. It's much more than any of us would have wanted to spend if we were, if we were each paying for our own bill. And insurance is a little bit like that, right? It's, people want to have health insurance because healthcare is very expensive and it's very unpredictable. So the way that insurance works is that you essentially are pooling and splitting your healthcare costs with a bunch of other people as a way of bringing the sort of actual healthcare costs of the group of the individual in line with the average, right? It's a way of pooling risk and pooling cost to make people's expenses more predictable and more manageable. And so it's a little bit like splitting the check at the end of the day, right? People end up consuming maybe more healthcare than they otherwise would if the costs are being split. Providers might end up providing more care than they otherwise would if they know that somebody else is paying for it, right? The patient's not paying, the insurance company is paying. And so, that phenomenon, economists call it moral hazard, right? The tendency of insurance to bring about an increase in overall spending compared to what people would spend if they were paying their own way. That seems to be one of the factors that leads healthcare spending to go up over time. It's a kind of collective action problem that's a sort of inefficiency, if you will, in the system. Private healthcare companies have their own methods for trying to control these things. But there's some reason to think actually that the state has some advantages over private insurers in holding down those rising costs. You can understand the use of cost effectiveness analysis of the kind that they do in Britain under the NHS as a way of trying to sort of control this. And private insurers often are not as successful as the state, in part because the costs of fighting expensive medical bills often they fall on individual insurers. It's a very costly thing to do, and your customers hate it. They're much happier if you just pay for everything and then raise their premiums at the end of the year. And so there's some reason to think anyway that the state is more effective at holding down those costs, and that's maybe another aspect of the sort of efficiency rationale for state involvement that is sort of goes along with that affordability question.
So I wanted to ask about like this kind of like private insurance and kind of like in the context of like state insurance versus private insurance. Like, is that even something that should exist? Like, should there be private insurances to begin with? Like, at the end of the day, it seems like a competition, which one's better, which one's like worse, is something that's like dominated by the state, insert like a state insured like insurance or something like that. Would that be better or is that worse? Like, I guess like the United States has always had private companies in every domain. So that's something that has like historically been like United States thing. But in the context of insurance, like, is it meant to be like for profit or like for the people? Like the generic question of like, which one should it be? Ethical concerns, and then also like kind of, I don't know, being motivated by money as well as your problems that happen within society right now. So what do you think on that matter?
Yeah, so this is a hard question. And I think that often, when you get into these policy questions at a certain level of granularity, you maybe get a little bit beyond what philosophy can tell you, and you need to just kind of start looking at the world and see what happens, right? So I want to just sort of say first that I'm not sure that I can settle this question with the kind of tools of philosophy rather than doing some actual policy analysis, right? However, that hasn't stopped me before. And so let me just say a couple of things. I mentioned already that from the point of view of this kind of market failures approach, the fundamental problem with insurance markets is this problem called adverse selection. And the way that you address that problem, or the way that most countries address that problem, is by making it mandatory that people have insurance. And as I already said, right, some countries do this through mandatory private insurance, and other countries have a single public insurance company that just provides care to everybody. If you go the private route, then once you're already mandating that people purchase a private product, then from the point of view of the ordinary functioning of the market, you're already kind of through the looking glass, right? You're in a whole new world once you're just compelling people to buy a private product. And a whole bunch of new regulations become necessary in order to make that work, right? So, if you look at countries like Switzerland or the Netherlands that have mandatory insurance, they also regulate those private insurance companies really, really carefully. That often the state is involved in setting the prices that providers can charge for particular treatments and that insurance companies can reimburse. There's often, a fairly high level of micromanagement of what needs to be in the insurance package and things like that. And so, my thought would be that once you get to that level of kind of tinkering with the operation of these insurance programs, it's not clear what the advantage of having 5 or 6 different private insurers for people to choose from really is, right? What is that doing that couldn't just as easily and maybe even more effectively be accomplished through a single public insurer once you're already defining what has to be in the package and mandating what the prices are going to be and all of that kind of stuff, right? So I think, it is hard to see what exactly that competition is really doing in the long run, given how carefully managed it is. The point about nonprofit is significant though, right? Because I think what people often have in mind when they're doing this kind of justice and healthcare debate is that what we need is a system of universal public insurance. And I do just want to point out that if your concern is fundamentally a concern about profit, and the way in which the sort of quest for profit puts insurance companies at odds with their customers, well, there's actually a way of solving that, which is what they do in Switzerland, what they do in the Netherlands, right? Which is just, you can structure those insurance companies as nonprofits. And so you can have a private company providing insurance, but a company that's organized as a nonprofit. And so you don't have a group of investors or a group of owners that are, sort of whose interests are at odds with the interests of your customers, right? So, I mean, this is, I think, one of the virtues of kind of thinking this through from a bit of a sort of economic orientation, right? That if the problem is a problem about profit, that doesn't necessarily mandate that you have state provision, right? You could solve that through a system of private nonprofit insurers, which is what they do in many European countries, right?
That makes sense. There's like a lot of information to unpack there. And like I guess there's also a lot of like philosophical questions maybe. And I don't know, while I was thinking about this, I was kind of thinking about like questions of like greed and stuff like that, which are completely different philosophical domain, but I guess they're also interesting when it comes to like the division between what is ethical to do in certain scenarios where you can make a lot of money. And so I guess like those play out when it comes down to questions of like profit like for-profit institutions, especially like investors and stuff like that. So all that is like really interesting stuff. I kind of wanted to transition a little bit more into questions that I guess like the audience has asked me to ask professors. So a lot of my friends and some other viewers have actually posted in the Discord about the questions about how philosophy classes are conducted in the first place, especially at a high school level. Not a lot of high schools offer philosophy, so the only introduction might be through like a philosophy club. And most philosophy clubs are discussion oriented. Obviously, there's no homework assigned or anything like that. So how does a philosophy class happen? Like, how is it graded? Given its subjective nature, how are these classes, graded, or what's the focus of these classes? Is it just like reflection, or what is it?
Yeah, good. So I would say a couple of things. Often what you are doing in a philosophy course is not just trying to answer abstract philosophical questions, but also studying historically influential and historically important attempts to answer those questions by famous philosophers, right? And so one way in which you get a measure of objectivity into a philosophy class is that we're not just sitting around and talking about what would be the what is the source of legitimate state authority, but we're studying Hobbes's answer to the question of the source of legitimate state authority, and we're studying Locke's answer and maybe Plato's answer, right? And so there is, of course, a measure of objectivity there in the sense of, we're doing history of ideas rather than history of politics or economics or what have you. But there's a kind of objectivity there, right? Being able to explain and defend the position of a historically influential figure. There's also, if you take a logic course in philosophy, for example, well, then you're really doing stuff that's not all that different from arithmetic, except you're using letters and symbols rather than numbers and symbols. And so there, you're solving problems, you're doing problem sets, you're doing derivations where there is a sort of objectively correct answer. But having said that, even in courses where, or for assignments where I'm asking my students to, not just to tell me what John Rawls said about this question, but to tell me their view. What we're really trying to train students to do in a philosophy course is to think critically, to express themselves clearly, to build arguments effectively. And so, there is there's no pressure in any of my classes that my students agree with me or that they take the positions that I hold. In a lot of ways, I prefer if they don't. It gets a little awkward if I feel like they're just telling me what I want to hear. But whatever their position is, right? Are they able to articulate it clearly? Are they able to defend it well? Are they able to construct arguments that have that are valid rather than falling into various sort of fallacies and other kind of errors in reasoning? So those are the ways in which objectivity enters into it, right? Philosophy is a discipline that I think is really helpful for people who want to be able to write clearly, who want to be able to argue well, who want to be able to understand other people's arguments and reconstruct and critique those arguments. And that's what you're really practicing when you take a philosophy course.
So is there also, I guess, like for beginners entering philosophy or like just exploring philosophy, like what does Northwestern do specifically? I know like they have like, I guess for kids who are interested in philosophy, they have like the scholars program, I believe, for philosophy. But like what else does Northwestern do specifically for kids who are just interested and want to learn more about philosophy?
Yeah, so we have a bunch of different philosophy courses, and many of our courses are, most of our courses actually are meant to be accessible to non-majors. And I would say, in fact, that, philosophy is a relatively small department in terms of number of majors compared to like econ or computer science or what have you. Most of the students who pass through my classes, most of the students who pass through any of our philosophy courses are taking those as non-majors, often taking them as what we call a distribution requirement. So we require our students to take courses from a bunch of different areas of study, historical studies, formal studies is what we call it, which is basically math and logic, social sciences, the natural sciences. And so, the students who come through are often taking our class because it's a values distro, or it's a social science distro, or what have you. We try really hard actually to make our courses accessible to people who maybe don't have any prior training in philosophy. We also have a bunch of different student organizations that people get involved in if they're interested in philosophy. The Ethics Bowl team, you may know about the Ethics Bowl competition, which is really a great way to sort of practice your skills in moral and political philosophy and applied philosophy, argumentation, and things like that. We have a couple of organizations for women in philosophy who want to talk about some issues related to their sort of experience in the discipline and some of the distinctive challenges that they face and so on. We have an undergraduate philosophy club, for people who want to just sit around and talk about philosophy. So there's a lot of opportunities to get involved if you're not going to take a class.
That's awesome. That's awesome to hear. I love it when like schools actually like make a focus on that, because it's really like an inviting kind of environment. And I did want to ask you, like what are you doing now? Like for audience members that might be interested in following up on your research or kind of what you're doing. What is your research focus now? Or like maybe if you're more heavy on like teaching, like what is that focus now?
Yeah, so right now I'm working on a paper on the topic of intergenerational justice. So one of the things that I do in my work on healthcare is I try to get people to stop thinking about healthcare in terms of equality and start seeing it as fundamentally an insurance product, right? And that the reason why the state is so involved in the provision of healthcare is precisely because of that market failure that we talked about in the insurance sector. Discussions about intergenerational justice are often or I shouldn't say often, are very much kind of, there's the same issue going on, right? Where people are inclined to see programs like Social Security in egalitarian terms, right? That they're redistributing wealth from young people to old people, that it's a kind of egalitarian project to make sure that older people don't live in poverty. I'm trying to get people to see Social Security for what it is, which is really an insurance product. And in particular, it's a kind of pension or an annuity, right? The way that an annuity works is that you pay a certain lump sum, or in the case of Social Security, you pay into it over your life, and in exchange, you get a stable income from retirement until death. And that provides a lot of actually valuable protection because you don't know how long you're going to live. And so if you're just building up a savings account or you're buying stocks in your 401k, the problem there is you don't know exactly how to parse that income out over your whole life because you don't know exactly how long you're going to live. And so just as with healthcare, right, Social Security, other kinds of intergenerational justice problems, I think can be productively viewed, first of all, through the lens of insurance and providing a valuable kind of protection against uncertainty, but then also through the lens of market failure, because these are products that the market is not good at supplying. And so the state can step in and provide something that will make everybody better off, rather than just, kind of redistributing wealth from one group to another.
That's definitely like a really interesting research topic. I haven't really heard about that. And like, kind of, I guess maybe I need to do some more research on like what insurance is before I enter, because, I guess like high schoolers don't really learn about that until you get into the real world, which we're not really in the real world yet, but we are in the real world. It's a really, really, interesting thing. But yeah, that about wraps up our discussion today. Thanks so much, Professor Horne, for being here and, your time and just answering all these questions. I learned a lot, and I'm sure our audience did as well.
My pleasure. Nice talking to you. Thanks for having me.